Here I'm going to talk about all we must know before to perform a blepharoplasty. First of all, there is a relationship between the eyebrow and the eyelid. When we are going to perform a blepharoplasty, we must to understand to see where is the position of the eyebrow. Because if we don't see this, maybe we are going to perform a wrong procedure. This is the technique that are from many years ago and surgeons use today. I think this technique of the upper eyelid is completely wrong. I'm going to explain why. Our interpretation is from the patient and surgeon is there is an excess of the skin of the upper eyelid. If we have an excess, what we are going to do is resect and change tissue that fall over the eyelid lashes to sulcus. But if you see carefully, you are going to see that this patient have the same tired expression or more than before the surgery, and also have the same wrinkles. All you are going to see here is the sad and tired expression after a conventional blepharoplasty, and these patients were taken from internet presented like an excellent result. For me is the opposite. Here we can see the position of the tail of the eyebrow before, and you can see after. Conventional blepharoplasty remove more skin where the eyebrow fall more ptosis, more resection. It's completely the opposite we must do. If the tail, the eyebrow drop, we must pull up, but the conventional blepharoplasty pull down. Generally, the head of the eyebrow remain in the same position during the years, and here we remove less. This is the procedure we perform, but I do not perform. But generally, the plastic surgeon perform is removing the skin, the muscles, and what they produce is a tired and sad expression in a very young patient. And also another question is when we age, the upper eyelid sunk, have a cadaveric expression. You can see in all patients you are going to see a sunken upper eyelid, and this was performed in young patients for a blepharoplasty. Then a patient come to my office and said, "Doctor, I want a blepharoplasty," and they pull up the tail of the eyebrow. And if I perform a blepharoplasty, I'm going to pull down. Generally, the aging process is a combination of the ptosis or dropping the tail and the body and a flaccidity of the upper eyelid. You can see the head is almost in the same position and the tail of the eyebrow have a ptosis. This line is to see that the head is almost not dropping at all. And when the aging process comes, we have dropping of the eyebrow, and this dropping of the eyebrow produces this sad and tired expression that seen in this draw. And here is conventional blepharoplasty, accelerating the aging process with the same old sad and tired expression. What I performed since 1984 is a stab incision in the upper eyelid, in the inner part of the upper eyelid, through which I remove the inner fat pads and the medial fat pads. It's very important to rejuvenate the skin, and I'm using carbon dioxide laser to tighten it. And this lower eyelid fat pad is taken from transconjunctival. Then I perform both blepharoplasty without skin resection, no scar here, no scar here, and the reposition of the eyebrow through 3 minimal incisions, from which I can perform in bold patient, in young patient, because have any cost at all, have no scar at all. You can see the expression of this face and this one. And this is 9 years after the procedure. You can see that the procedure is long lasting. And this is a combination of many techniques. It's a surgeon that have a little visualization. The area of visualization is very narrow because have a ptosis of the eyebrow. And here is a combination of the reposition of the tail, eyebroplasty, carbon dioxide laser treatment, improve the visualization, and this 4 days after the procedure, these tapes I left in place 7 to 10 days in order to fix the periosteum to the bone. You can see no scar, and the result of improving the view. And here you can see the comparison with one side to other side. What I'm saying, from the malar area to the forehead to the hairline, never is necessary to leave a scar, and all the skin is tightening and rejuvenated with the action of carbon dioxide laser. And also it's very important the malar voluminization. From the malar to the hairline, never is necessary to leave a scar. All kind of laxity of this area, the lower eyelid in the mal and the malar area, can be tightening and rejuvenated with the action of carbon dioxide laser. You can see this, the shortening of the length between the eyelid and malar area. This is called lid-cheek junction, the union between the lower eyelid and the malar area. Lower lid cheek junction. Here is the lower lid cheek junction, and here you can see the shortening of the area, malar volumization, wrinkle treatment. I performed this treatment many years. You can see these horizontal lines and how it is improved. Here this patient do not perform laser treatment, was her decision. Here is 1986, the reposition of the tail of the eyebrow without any scar. 3 minimal incisions, 1 centimeter each, inside the hairline reposition. I think it's almost impossible to rejuvenate the face and the periorbital area if we don't use carbon dioxide laser. You must ask your medical doctor if he uses carbon dioxide laser to tighten and rejuvenate the skin. And one important thing is the expression of the face. You can see quickly one side to other side. What do you see? Satire and young and rested expression. This patient was operated 2 times blepharoplasty, and patient said, "Doctor, you can make another blepharoplasty and produce this." And I said, "No, what do you need is reposition of the trail. With these 2 surgeries of the lower eyelid, you have lowering the eyebrow. And here is the reposition. Subtle expression. This is rested expression. Well, we are going to see faster 2004. You can see I reposition the eyebrow. The wrinkles not disappear, but show less wrinkle, because it's not necessary to the frontal area to pull up the eyebrow. I think it's simple. Young patients. And also with this technique I reposition the tip of the nose. You can see here. And it's a big change of full face rejuvenation, the expression of the look. If the patient have a lot of wrinkles, I perform a higher laser rejuvenation, but the results are unbelievable like this. In one procedure, the patient rejuvenate many years, I think many years. The long-lasting result, the patient sent me live in outside of my country and send me this picture 9 years after the procedure. I hope you have enjoyed this presentation, and I hope you can understand more about the physiology of this aging process. You can send us from outside of the country. You can send a WhatsApp or a mailing, and we are answering you, and we can have a contact via video conferencing. Have a nice day.